Hi, I'm Andrew Davidson. I'm a neurosurgeon at Royal Melbourne Hospital, Peter MacCallum Cancer Centre and Melbourne Private Hospital in Melbourne, Australia. Today I'd like to talk to you about the Gamma Knife. So what is the Gamma Knife? The Gamma Knife is a machine that delivers radiation to treat brain disorders, including brain tumours, vascular malformations and functional disorders such as trigeminal neuralgia. It delivers a highly focused, high-dose radiation to a target area, minimising exposure to surrounding healthy tissues. This process is also known as stereotactic radiosurgery. Radiosurgery is often used when traditional open surgery is not possible or when a patient wishes to avoid the risks associated with open surgery. It's a highly effective treatment option for many conditions with a high success rate and a low risk of complications. However, it's not suitable for all neurosurgical conditions. So that poses the question, what conditions is the Gamma Knife used to treat? Well, it can only be used to treat brain conditions. It can't be used to treat any tumours in any other parts of the body. The most common indication for Gamma Knife treatment is secondary brain cancer or brain metastasis. We can treat single tumours as well as multiple brain tumours in a single treatment session, depending on the size and the location of these tumours. The most common benign tumours that we treat are vestibular schwannomas, also known as acoustic neuromas, as well as meningiomas, pituitary tumours, and Gamma Knife can also be used to treat non-tumour conditions such as brain AVMs or vascular malformations and trigeminal neuralgia or facial pain. So how does the Gamma Knife work? Well, the Gamma Knife uses 192 sources of radioactive cobalt to deliver high-dose radiation to targeted areas in the brain. These 192 beams are shaped to precisely focus on the target while minimising exposure to the surrounding healthy brain tissue. Depending on the condition being treated, the head of the patient might be held in place using either a relocatable plastic face mask or a rigid frame attached to the skull. How long does it take for a Gamma Knife treatment? The Gamma Knife treatments are performed as a day procedure, with patients awake throughout. Even though the word knife is in the title, there are no incisions. Most treatments are performed in a single day, although some tumours might require a series of 3 or 5 days of treatment, and you go home at the end of the day after each treatment. So what's the difference between a frame-based treatment and a mask-based treatment? Well, most Gamma Knife treatments for secondary brain cancer or metastases are done using a relocatable thermoplastic mask. This allows immobilization of the head without having to apply a rigid frame. By the same token, most Gamma Knife treatments for benign tumours or non-tumour conditions are done in a rigid frame. Both of these techniques effectively immobilise the head. However, the frame allows for more rigid immobilisation, which provides slightly more precise treatment delivery, which is needed for the more benign conditions. So how then is a frame applied? Well, if you're having a frame-based Gamma Knife treatment, you'll come into Peter Mac early in the morning and be admitted by one of our radiotherapy nurses. You'll then be brought around to the Gamma Knife frame treatment room where you'll meet the neurosurgeon, me or one of my colleagues, who will apply the frame. The frame is attached to the skull by 4 metal pins, which are tightened on to the outer part of the skull, passing through the skin and gripping on to the bone. In order to attach the pins, the skin at the insertion site is numbed by an injection with local anaesthetic. Now this stings a bit going in, but then the skin goes numb, and this allows the frame to be attached without any more discomfort. The pins need to be very tight to ensure that the frame doesn't move for the rest of the day, and the feeling of pressure can seem pretty intense while the pins are being tightened, but that tight sensation goes away once all of the final adjustments are completed. The frame then remains attached for the rest of the day while you have your MRI, CT scan or angiogram, depending on what treatment is being done. You can move your head, you can walk about, you can even eat and drink while the frame is on, and while you're sitting and waiting for the treatment to commence. During this time, after your imaging, the radiation oncology team will be using special software to plan your treatment, and then the radiation physicists check the system and the plan for accuracy and safety. This process can take some time, but while you're waiting for the treatment plan to be completed, you'll be in a waiting area where you can have something to eat and drink, you can read a book, watch TV, or chat with family while you're waiting for your treatment plan to be completed. Once the treatment plan is approved, then you'll be taken into the Gamma Knife treatment room where you'll lay down on the Gamma Knife couch and the frame will be attached to the head of the bed. Again, you'll be able to speak, you'll be able to move your arms and legs, but you won't be able to move your head while the frame is secured to the Gamma Knife machine. Once all of the checks have been completed, the radiation therapists and nurses will leave the room and the Gamma Knife treatment will commence. Now, you can't see or feel radiation, but your treatment will be monitored from a control room nearby, linked to the treatment room by closed-circuit TV cameras and audio. If you need to communicate with the radiation therapists who are running the treatment, then you just need to speak up. We can play music of your choice through the speakers in the room while you're having your treatment, and most treatments will take less than an hour, although some larger tumours or vascular malformations may require a little bit longer treatment times. At the completion of your Gamma Knife treatment, the frame will be disconnected from the Gamma Knife bed, and you'll then walk back to the frame fitting room where the frame will be removed. After a short period of observation, you'll then be allowed to go home. This process might take most of the day. Most people are able to return to usual activities, including work or study, within 1 or 2 days of having the Gamma Knife treatment. And if you have a frame-based treatment, the small puncture wounds at the pin sites are usually healed within a week. How can you find out more about the Gamma Knife treatment options? Well, the Gamma Knife is located at Peter MacCallum Cancer Centre, where I'm the neurosurgery lead for the Victorian Gamma Knife Service. Your GP can refer you to see me at Peter Mac, or in the private rooms at Parkville Neurosurgery, where we can discuss whether Gamma Knife is an option for your condition. You can also visit my website, www.asdavidson.com.au, for more information about the Gamma Knife and about the neurosurgical conditions I treat, as well as my consulting locations. Thank you for watching my video today.